Bipolar disorder is a form of mood disorder, and the term refers to a condition in which patients experience mood swings between the two extremes of depression and mania. And bipolar disorder is referred to in older literature as manic depressive illness, and it is important to note that the affected patient usually presents with one predominant mood state at a time, either depression or mania. A single manic episode and a history of depression qualify for classification as bipolar disorder. A current episode of depression without a past manic episode is not diagnosed as bipolar disorder. Repeated depressive episodes are diagnosed as recurrent depression. The causes are largely unknown, and possible associations are tendency to run in families and also genetic factors. Symptoms are persistently elevated mood, as euphoria, expansiveness, feeling high or irritable, and also overactivity, talking fast and excessively, grandiose claims, reduced sleep, reckless spending, and being overly generous, sexual and social disinhibition, auditory hallucinations. In severe cases, patients may hear voices, often reinforcing their grandiose beliefs. Undue suspicion as paranoia may also exist, and impaired judgment. So the signs that are usually elicited are same as the symptoms. Sometimes there are none typical of bipolar disorder. This investigations rarely thyrotoxicosis may mimic mania and must be excluded. Usually no specific investigations are required. The main treatment objectives are to treat symptoms of mania or depression, whichever is present with recurrent episode. Also to reduce the level of activity in mania to a manageable state, and to elevate mood to a normal state in depression, to abolish psychotic symptoms, delusions, and hallucinations if present. Non-pharmacological treatment, we have psychotherapy and psychoeducation. Pharmacological treatment, with the management of manic patients, you give risperidone oral in adults 1 to 4 milligrams 12 to 24 hourly to a maximum of 8 milligrams daily. In children more than 12 years, give 500 micrograms stat, and then adjust daily in steps of 50 micrograms to 1 milligram daily to a maximum of 6 milligrams daily. Less than 12 years is not recommended. You can give olanzapine oral in adults 5 to 15 milligrams 12 to 24 hourly to a maximum of 20 milligrams daily. And children 12 to 18 years, give 2.5 milligrams daily up to a maximum of 20 milligrams daily. Less than 12 years is not recommended. You can give haloperidol oral in adults 5 to 10 milligrams 12 hourly up to a maximum of 20 milligrams daily. Or you can give chlorpromazine oral in adults 25 milligrams 8 hourly or 75 milligrams at night, and then increase by 25 milligrams daily to 50 to 100 milligrams 8 hourly. Or you can give sodium valproate oral in adults 250 to 750 milligrams 12 hourly, controlled release preferable. In children less than 18 years is not recommended. Or you can give carbamazepine oral in adults, 200 to 800 milligrams 12 hourly. Controlled release preferable. In children less than 18 years, it's not recommended. Management of significantly aggressive patients. You treat the acutely disturbed patients appropriately. So management of the depressive phase, you give lamotrigine oral in adults, 25 milligrams daily for 2 weeks, and then you increase by 25 milligrams every 2 weeks to a maximum of 200 milligrams daily as required. In children less than 18 years, is not recommended. And you can also give lorazepam oral in adults, 2 to 3 milligrams 8 to 12 hourly, the maximum of 10 milligrams daily. In children 2 to 18 years, we give 0.05 milligrams per kilogram 8 hourly with a maximum of 2 milligrams daily. Or you can give diazepam oral in adults, 5 to 10 milligrams 6 to 12 hourly, and in children 12 to 18 years, give 10 milligrams 12 hourly, and 5 to 12 years, give 5 milligrams 12 hourly. The benzodiazepines are withdrawn as soon as the patient is calm, but this should be done by slowly tapering the dose. The management after control of the acute phase, as a maintenance management, you give lithium oral in adults, 200 to 600 milligrams 6 to 8 hourly, with a maximum dosage of 2,500 milligrams daily. In children 12 to 18 years, give 200 to 600 milligrams 8 hourly, the maximum of 2,400 milligrams daily. And 6 to 12 years, we give 5 to 20 milligrams per kilogram 8 hourly, and less than 6 years is not recommended. You could give lithium sodium valproate, but for the lithium levels should be monitored 12 hours after dose, twice weekly until condition stabilizes, and then once every month. Okay, so you could also give sodium valproate oral in adults, 250 to 750 milligrams 12 hourly. Controlled release preferable. In children less than 18 years, is not recommended. Or you can give carbamazepine oral in adults, 200 to 800 milligrams 12 hourly. Controlled release preferable. Children less than 18 years is not recommended. Referral criteria: so refer all patients suffering a first episode and not responding to treatment after 1 month, and all children to a psychiatrist.